We begin today with a bleak assessment by the nation's top doctors around the coronavirus pandemic, and that is if the country reopens too quickly. At a Senate hearing on getting Americans back to work and school, Dr. Anthony Fauci and 3 other federal health officials told senators many more could die if states do not prepare adequately. The warnings come as a majority of states begin to reopen, with several failing to meet federal social distancing guidelines.
Reported cases of the coronavirus in the U.S. are nearing 1.4 million, and more than 82,000 people have died. Gwen Baumgardner has more on what health officials say needs to happen next.
Dr. Anthony Fauci delivered a stark warning to Congress yesterday about rushing to reopen the country.
There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically, will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
The nation's top health advisors and many senators attended the hearing remotely to discuss the response to the coronavirus pandemic.
So by September, we project that our nation will be capable of performing at least 40 to 50 million tests per month.
It's important to emphasize that we're not out of the woods yet.
President Trump has tried to paint the effort as a success.
We have met the moment, and we have prevailed.
But senators say there's still work to be done.
I find our testing record nothing to celebrate.
The time for magical thinking is over here. President Trump must acknowledge that the federal response has been insufficient.
Kentucky Republican Rand Paul pressed Fauci on his cautious stance.
I don't think you're the end all. I don't think you're the one person that gets to make a decision.
I have never made myself out to be the end all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence.
Fauci says with more than 150 children infected with pediatric multi-system inflammatory syndrome, possibly linked to COVID-19, there's still a lot even he does not know. Gwen Baumgardner, CBS News.
CBS News political contributor Molly Hooper is with us now to talk more about yesterday's hearing. Molly, it was interesting. We showed in Gwen's piece there Senator Rand Paul of Kentucky essentially having a pretty tough conversation with Dr. Anthony Fauci there. But what we didn't show is Anthony Fauci's response. Senator Paul was essentially accusing him of making decisions for the country, making decisions with regards to the economy. And Dr. Fauci pushed back on that, saying, look, I'm not responsible for the economy. All I can talk about is public health. Dr. Fauci gives recommendations to the U.S. government. The U.S. government then decides or decides not to follow his guidelines. What Dr. Fauci was saying is, if you don't follow my guidelines, be prepared to reap the repercussions of not going along with what he says. But Rand Paul was seemingly the only one who sort of took that position. Almost everyone else had some serious questions for Dr. Fauci and the others that were there.
Right, they did. And Dr. Fauci, you're right. He basically said, listen, I'm not an economist. That's not my role. My role is to be, I'm a physician, an epidemiologist, and I give advice based on the science out there. And as you said, Vlad, he went on to say that, the president can do with it what he will. And actually, when he was asked at the very end of the hearing by Kelly Loeffler, the newest senator from Georgia, a Republican, she said, some in the media and at this hearing want to paint a picture of you as having a confrontational relationship with this White House. And each one of the doctors up on that panel said, no, it's not confrontational. We give advice, he listens, and he does what he wants with it. But noting that their role is to advise the president, it's up to the president ultimately to do with that what he will.
Yeah, I thought that Rand Paul's questioning was sort of interesting because there were other people on that panel. Right. And we know that Dr. Fauci, though he may be one of the most trusted, people on this topic in this country, he's not the only one giving advice. It's just that all of the other people on that panel also agree with Dr. Fauci. So do many of the local health departments in various states. It's not just coming from him. But speaking of various states, there was a discussion during the hearing about whatever happened to the CDC list of recommendations advising states should they decide to reopen. Apparently they were written, and then the White House took a look at them, and then there was suggested some revising of them, and so they're back with the CDC. That's kind of like the answer that we got. But in the meantime, states are reopening, and they don't have access to these guidelines, and they're reopening without actually complying with the White House's own suggestions as when you should reopen. So I'm wondering, after all of this testimony, is this going to actually have an impact on the states reopening? I mean, are governors even listening?
That's the key question. I think it was one that was really summed up well by Chris Murphy, a Democrat from Connecticut, who said, listen, you guys are saying that we need to follow these guidelines. We need to, essentially use this certain playbook to reopen. But when the president is going out and saying that we have prevailed in our testing, which a lot of those witnesses did not seem to confirm yesterday, and that the CDC has not provided those step-by-step, those steps to take in order to reopen safely, Chris Murphy said it's almost criminally negligent that you have not provided that for us, because if the president's saying one thing, state governors are going to have a very difficult time getting their constituents and their residents to safely social distance. And until we actually have a list of steps to take that are coherent and available to us, we can't move forward with the confidence that we are doing the right thing to reopen our economies. And again, when several of the senators pressed the CDC director, Robert Redfield, on that matter, Robert Redfield said, we'll get back to you. Essentially, that's what he said is, we'll have those for you soon. Well, these senators are hearing from their constituents. They're hearing from their own residents. And the challenge is the governors need to have all the information available in order to safely reopen their states. And they can reopen in whatever way they plan to reopen. But if they don't have those guidelines and there's a disconnect, that's a big challenge. And I think that that's a frustration that we heard from all the senators, Republicans and Democrats.
Mm-hmm. Yeah, and some other just key points out of that hearing. You heard from Senator Mitt Romney, who sort of rebuked Admiral Giroir there, who's the Assistant Secretary for HHS, that the president and Admiral Giroir sort of celebrated the numbers of testing that is happening across the country. And Mitt Romney gave the important context, of course, that South Korea began much earlier once the pandemic hit, and he called what the U.S. response was treading water for the months of February and March. And Senator Bernie Sanders also speaking to Dr. Fauci, making the point that he believes, Dr. Fauci, that the numbers as reported of people who have died from the coronavirus is much lower than he believes. All right, but Molly, I want to switch topics here. Go ahead.
I was just going to say one other point that I've heard senators grumbling about in the background is this issue that the CDC wasn't able to continue contact tracing. That is essentially finding all the contacts of an individual who has been infected with the coronavirus, essentially to contain it. So you can let all those people he's had contact with know, and they can self-quarantine. CDC Director Robert Redfield said that stopped happening mid-March because they didn't have the capacity to do it. Now, that's a major concern for senators as they look towards the fall when people are going to be going back to school, or at least they want to go back to school and get back to work.
That's right. He said, in fact, that we lost a containment edge and now we're in the mitigation phase of it. Really important point there, Molly. Switching topics, I want to ask you briefly about the Democrats releasing another coronavirus relief bill. What are the key components of that bill, and what are you hearing from Republicans?
Well, I'm hearing from Republicans it's largely a no-go. House Republicans, it's almost a given. This package is $3 trillion. That's more than the first CARES Act and the second CARES Act are pretty much combined. It has a lot of money, billions of dollars for states, for first-line workers, for healthcare providers, for people who've been furloughed. I mean, there's a lot of money in there that really goes back to the states and bolsters programs. But there's also some goodies in this bill that a lot of Republicans have been pointing to, one of which being a provision that would bar the president from firing any inspectors general general without due cause, essentially, or that person has committed a felony. There's also language related to medicinal marijuana in banking, provisions that require employees of Amtrak to wear masks. I mean, there's just a whole host of, you could say, progressive sort of goodies, studies for the EPA to, that would link pollution to health. There's a lot of stuff in there, but mainly the point is the House Democrats are really trying to force the Senate Republicans' hands to move on another package that would send money back to the states and get it to healthcare providers. That's something that Mitch McConnell has said that he really doesn't want to do until the money that has already been allotted has been spent. And House Democrats are very frustrated by that. So when we see the House vote on this on Friday, likely Friday, it's probably going to be a very party line vote. I don't think it will go very far in the Republican-controlled Senate, but that doesn't mean the Republican-controlled Senate is not working on another package that would tackle a lot of the issues that the House Democrats are tackling in this massive HEROES Act, as Speaker Pelosi has named it.
All right, Molly, thank you very much. As always, we appreciate it.
Thank you.